Hey, I'm Dr. Brad. I'm a physical therapist. The video today is all about the Q angle. The Q angle measures the pelvis and the femur. So that's your hip bones and then your leg. And what angle does that leg go at? The problem is that women have wider hips, obviously because of childbirth. So that creates a larger angle from the hips down into the leg. This becomes important when we look at the mechanics of how the hips and legs move. If the hips are too weak on the outside, this is going to cause the legs to fall in, putting more force on the knees, causing damage to the knees, and then causing the muscles on the inside of the leg to try to compensate. They become tight, leading to additional problems. If you have more questions about the Q angle, what it is, and how it affects you, put that in the comments down below. If you have knee pain, make sure you check out our video all about knees and the different injuries that can occur there. If this video was helpful, make sure to hit the like button. And then if you want to see more videos about your knees, hips, or any other injury you might have, hit the subscribe button. We'll see you on the next one.